My name is John Adams, and I am a success story for an innovative drug therapy. And let me explain briefly my journey. I was morbidly obese. I had severe coronary artery disease. I also became, my A1C rose to the point where my family doctor insisted we had to do an intervention. I was officially pre-diabetic. This goes back to the middle of 2022. I said, how about the version of Semaglutide that was available in the marketplace at that time? And she said, yes. My family doctor said yes. And I credit it, since the middle of 2022, I have managed to change my life and improve my health and reduce my body mass by 110 pounds. The first 30 pounds were directly the result of Semaglutide. It got me on the right track. I also had a professional health coach who insisted upon 1% improvements, many 1% improvements in my lifestyle. Over those 2.5 years, almost now, in addition to the weight loss, I've also switched my diet to a Mediterranean diet, eliminated most red meats, eliminated all forms of added sugar, and increased my exercise regime as well, the classic diet, exercise, and effective drug therapy. Along the way, I also plateaued after losing 30 pounds. And it turned to the other tools, the health coach, the diet changes, and the exercise. And then I had lost a total of 50 pounds. And then I had a significant coronary event. It was not a heart attack or a stroke. It was massive and acute angina. Turns out I had a 90% obstruction of the main coronary artery, which was successfully removed non-invasively. I credit the fact that I did not suffer a heart attack to the fact that I was on the semaglutide therapy in March and before March of 2023. Since then, I've continued to lose weight, continued to improve my diet, improve my exercise, eliminated all forms of alcohol. I've also had a cancer scare along the way, successfully resolved so far, and I continue. And I'm happy to report that in my migration across more than one semaglutide therapy, I have now, through my private insurance, received prior authorization to commence the use of Wegovy. And I note that just last week, Health Canada expanded the label indication to include prevention of some forms of coronary disease, and exactly the type of coronary disease I have and that I experienced back in March of 2023. I'm alive and well today because of semaglutide. Please make it available to lots more Canadians.